There are so many issues that impact us as nurses. And what we want more than anything at all, is to give the best care that we can give. And when we are placed in a situation where we can't do that, and where the patient's safety is at risk, it not only puts our license and our livelihood on the line, but it puts our consciences and our own personal emotional well-being on the line. It is it's so time to make this happen. I can't believe that we're still even having this discussion. We should have had nurse staffing ratios years ago, nationally, federally mandated ratios.
Usually by saying to people, isn't it amazing that the employers, the hospital employers, create these conditions which drive nurses and other workers out of their workforce, and then complain publicly about the shortage of nurses. And so the effect that staffing ratios had on recruitment and retention, I think the last statistics that I looked at in the state of California said that 80,000 new nurses registered nurses came into the workforce in the state of California, okay, as of January of this year, of 2008. Okay, and that for the first time in many, many years, the trend was being reversed, that we had more registered nurses coming into the workforce than leaving the workforce. And that is quite an accomplishment. And I attribute that directly to the impact and the effects of nurse-to-patient ratios. But I wanted to focus on just a few things that I saw personally. One is that ratios saved lives. And there's continuing data coming out of California about lives, patients' lives that are being saved by minimum staffing ratios. And when we say minimum, we mean minimum because it's minimum, and then there's the acuity system in California also, which the employers have to honor and staff according to acuity also. So it's only a minimum ratio. The ratios can be lowered even further depending upon acuity. But it saved lives, and I think there's a growing body of evidence that just is logic, that the higher the license on the unit, okay, the better the patient outcome. And so it's the situations where we have hospitals, for example, in other states like the state of Oregon, where de-skilling is still an option out here. For any of the major hospital employers, we see it all the time. Okay, is that de-skilling and giving registered nurses more patients and fewer licenses on the unit to coordinate care with. And that has taken a turn for the better in California, and so I like to say saving lives is one of the outcomes, okay, of nurse to staffing ratios in the state of California.
Well, labor and delivery, I know it's, patient, they're saying, I'm scared of what's going to happen. You say, I'm sorry, can you hold that thought? I have to go take care of somebody else. That's, yeah, sorry you're in pain, but I'll be right back. That's not really appropriate care. If their baby is at all, if there's any concern with the baby, if you've only got one nurse, then, you can't be watching mother and baby at the same time if there's something wrong with both of them. You get a patient feeling like they aren't getting adequate care, meaning hands-on care or even emotional care. And I think that's a huge thing. And as far as safety for the patient, that's another thing. So you get just this lose-lose versus we could have a win-win if we had safe and good ratios for staffing, I think. You get nurses staying in the profession, patients saying, woo, I'm getting good care, and the hospital's getting what they need.
Thank you.
I know that we've lost over 200 nurses from Legacy in the last couple of years just to Kaiser. It's been documented on the Kaiser side. I don't know how many we've lost to other hospitals, but I can tell you I've been a nurse now for 30 years, and every day I come in, we are understaffed. They are looking to cut every single moment. You are not allowed to sit at the desk, even for charting. We have mobile computers that we stand at. We don't look at patients. We are just keying in data. It's very technical. If we sit, we are flexed out. Flexed out means that you are sent home. And this is because they are trying to cut labor so that they can increase their bottom line. And anytime any of us make a suggestion, and again, if you've been there any length of time, you see these cycles happen where they decide that they're going to combine units and cut staff, and they're telling you it's because it works more efficiently this way. But what they're really doing is cutting nurses on the backs of nurses to increase the bottom line. And, you know, it's more than time. And when I see this card here that says that the government regulates staffing ratios for flight attendants, I think, case closed, you know, we're overdue.
And quite frankly, this does nothing but personify the fact that hospital management considers you nothing more, nothing less than the ultimate variable cost. It is you who they will balance their books on. And I say to hospital management, no way, no how, it has to stop. When the Oregon Territory was established, the northern border, the fight cry was 54-40 or fight. I suggest to you in this legislative session is 34-16 or fight.